Well, with COVID numbers so high, people are starting to question whether it's safe to venture out for even important reasons, like your routine dental appointments. Dr. Mike Rostami and Dr. Maya Brooks are with the Greater Baltimore Prosthodontics and Periodontics. Thank you so much for being with us.
Thank you for having us.
I'm happy to have you here. So I have heard that your practice is COVID ready, as they say. So tell us what you are doing to keep all of your patients and your staff safe right now.
So I'm the president of Baltimore County Dental Association. So a lot of what I'm going to say about our practice applies to all dental offices in the county. Since the beginning of this pandemic, the dentists were prepared for this as much as they could be. Dental offices every 2 years, all dentists in the state have to have certification in infection control. Dentists were used to dealing with HIV and Hep B and Hep C and all this stuff before airborne diseases came along. Most dental offices have upgraded their air conditioning system as far as having UV lights in there. They have air purifiers in each room. The way that we are staggering the patients, so there's minimal wait time in the reception area, minimal contact time with patients. We're doing enhanced cleaning of the office. All the reception area chairs are getting wiped down. Basically, any surface that patients touch is getting wiped down. And what we're doing is also all the precautionary stuff. We're doing the temperature checks to make sure the patient has not had any contact with anybody that's been sick. Anybody that travels out of state, according to governor's rules, we're encouraging them to get COVID testing. I actually went through the certification through the state to do rapid testing at our office. So even we could do rapid testing at our office. It's not as accurate as the PCR testing that the state's doing, but we're able to do rapid testing.
So it sounds to me that it is sort of one-stop, not shopping, but you can get all your medical needs done, or dental needs rather, I should say, right at your practice. So talk about what it is that you offer in addition to the rapid testing, which of course right now is very crucial.
Yeah. So I wanted to introduce Dr. Brooks. She's a general dentist with us. We have a group of 4 dentists. I'm a periodontist, dental surgeon. We have 2 prosthodontists here, and pretty much anything that's short of orthodontics, we can manage in-house here. We have our own subset of patients that we treat, and we also accept referrals from local dentists that send us patients for limited specialty care.
And so Dr. Brooks, did you want to tell us a little bit more about that as well?
Sure. I've been practicing with this practice for about 18 years, and it is wonderful to be multi-specialty. I do general dentistry, and Dr. Rostami does the surgical aspect. He's a periodontist and a prosthodontist, and we also have 2 additional prosthodontists, Dr. Max Wally and Dr. Michael Linan. So we try to keep as much in-house and make it easier for the patient, which is wonderful.
And part of keeping that in-house is the fact that you guys have a lab right on site. Is that correct?
Yes.
And so tell me how that impacts your patients and the advantage of having a lab on site for your practice.
So the advantage of having the lab here is 2 things. One is we can turn the cases around much quicker. We don't have to wait for shipping or anything like that. Second thing is we can manage the quality of it. If somebody needs a shade match or something, we have our ceramist here. If you're trying to match a front tooth, it's very difficult to match a natural tooth to a porcelain crown. Whereas if having our ceramist here, they could come out here and basically pick the color, we can shade it, they could bake it in the oven, and we'll have it ready for the patients.
So it's a lot quicker than trying to do that process and sending out and seeing if it works and sending it back. You're doing that right on site.
Yeah.
That is great. Okay. So people are going to watch this. Of course, they're going to say, you know what? I have been putting off my dental appointment. In fact, I think I've been one of them, not consciously, but I just think you have so much going on in the middle of the pandemic. Now is the time. We're starting out a new year, so we can cross that off of our to-do list. If someone is watching and they want to get in touch with your practice, how do they do that to set up an appointment? Where should they go?
Our office number is 410-296-0136. But I encourage every patient out there in Baltimore County or anywhere else to contact their dental office. It's a very safe environment. The American Dental Association showed that there was basically 0 transmission that's been documented in a dental office. Dentists are pretty safe. And also at the same time, I wanted to also give a shout out to Baltimore County Health Department. I've been in contact with Dr. Branch and also the Baltimore County Executive's Office, Johnny O, and his Chief of Staff, Patrick Murray, in trying to get dentists to get the vaccination themselves, and also down the line to be a frontline worker to distribute the vaccine.
Well, I'm glad that we live in an area where everyone is taking this so seriously, and I know that your practice is one of them. I want to thank both of you doctors for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.